know as patients get older that the rate of active inflammation decreases. The frequency of their clinical relapses, the number of new lesions in MRI, they all go down over time. Particularly as patients get into their 50s, into the mid to later 50s, the frequency of that disease activity, the active inflammation, goes down. It then raises the question of, well, when can patients stop these therapies? When can patients come off of the therapies? Because they do have risks, they do have potential complications, and they are expensive. And so when can we consider stopping? We don't know, and indeed there is an ongoing study now led by Dr. John Corboy at the University of Colorado, which is randomizing patients to come off of therapy or stay on. He and his colleagues are enrolling patients who are age 55 or over and have been stable on their MS therapy for 5 years or more, and randomizing them to come off or stay on to see, does the disease come back? What predicts the disease when it does come back, if it does come back, and what are the safety complications of either staying on or coming off of the therapy? It's an important question. We don't know the answer, but again, there's a trial ongoing now which will hopefully give us some answers. One of the concerns about stopping MS therapies is if the disease comes back, will it be a worse form of the disease? Will it be more aggressive? Will it be more injurious? Is there less reserve in an older patient with other medical complications perhaps? At this point, we don't have any evidence to suggest that it's worse. We don't have any evidence to suggest that a relapse in an older patient is more injurious or more problematic or more likely to leave permanent injury than a younger patient. And in fact, if anything, the fact that the disease is less active in older patients, one might expect that there's less robust injury, less robust inflammation in older patients who are less likely to have it in the first place than the younger patients who tend to have more exuberant and very active and injurious inflammation as part of the original onset of their MS. So we don't know the answer of whether it's worse to have a relapse older or younger, although there's reasons that think it may be less worrisome. One of the challenges in discussing with patients to stop therapies is that patients tend to be on one end of the spectrum or the other. They end up feeling very comfortable with their MS therapy, they're able to afford it, they tolerate it, and the risks are manageable, or they really don't like their therapy, they're tired of the injection side effects or some GI side effects or one thing or another, or coming to the infusion center once a month for infusions. It's variable depending on the therapy, but patients end up being in one end of the spectrum or the other. They either are very comfortable and want to continue, or they kind of really don't like it and are eager to get off. So we end up not having many patients in the middle that we can enroll in a clinical trial because patients are on one end of the spectrum or the other.